everyone, my name is Faiza and today I'll be teaching you the introduction course for anatomy. Now, what am I going to cover in this video? What is anatomy? Why is it important to learn anatomy? The different types of anatomy, how can it be studied, the anatomical positions and different planes, the terms, location, and movement words. Coming to the subject anatomy, what is anatomy? So anatomy originally comes from the Greek word temnin, which means to cut. And when we dissect the human body, we see so many different structures, including bones, as you can see in this picture, and the vertebrae, which make up our spine, and ligaments, which help tie up bones together, and some capillaries, and some arteries, nerves, veins, all of these structures, and even organs like heart, brain, kidney, gallbladder, etc. Now, why is it so important to learn anatomy? Anatomy basically is the root subject of medicine, of dentistry, of physiotherapists, of general practitioners, of surgeons. Basically, it's really important to know anatomy in order for anyone to become a doctor or a surgeon or a dentist. Now, why is it so crucial? Because it basically helps you identify the structures. And when you identify the structures, you can easily catch the diseases. Now, there are three very important tools or key techniques, as I'd like to call them, to understand this subject, which is observation, visualization, and imagination. So a person studying anatomy needs to have these three skills for them to ace anatomy. Now, the different types of anatomy, if you can broadly classify anatomy into gross versus microscopic. Gross anatomy is something that I can see with my naked eye, like large structures, they're easily observable. And then there comes the microscopic anatomy, which many schools call histology. So it's basically something like, for example, knowing the contents of the blood, like the RBCs, they're not visible to the naked eye. You would need a microscope to go ahead and look them up. Now, how can it be studied? So there are these three approaches that I mentioned here: regional approach, systematic approach, clinical approach. So the regional approach is basically, for example, just the arm. I'm just going to take the arm and I'm going to study every structure that is there in this arm. And systematic approach is going by the systems, which means like the respiratory system, which is the breathing system, digestive system, which is the food processing system, lymphatic system, cardiovascular system, etc., etc. Now, clinical approach is basically to do with clinical cases. So some example, Gray's Anatomy book has many clinical cases which are related to the topic itself, be it the systematic approach, be it the regional approach, whichever approach you might go through. I think including clinical cases gives students the opportunity to go ahead and visualize. Now, anatomy, position, and different planes. So this is the usual anatomical position. So the anatomical position is basically when you're standing upright with feet together, hands by the side, and the face is looking forward. Your mouth is closed. There's a neutral expression on your face, or the eyes are open and focused on something in the distance, and the toes are pointing forward. The thumb is a bit to the 90-degree. This is the anatomical position. So if in case your professor asks you to stand up right in the anatomical position, this is how you should stand. Now coming to the planes. So there are three major planes that we would be studying today, which is the sagittal, coronal, and transverse plane. So coronal plane is basically cutting the body into anterior and posterior parts, meaning the the front part and the back part. The sagittal plane goes ahead and divides the body into two different parts, the right and the left. And then transverse plane divides the body into superior or inferior. Going to the next, which is the anatomical terms, the location. So some of these words that you might see here, they seem hard right now, but are really easy. So anterior, posterior, meaning anterior means the front part, posterior means the back part. Medial, which basically anything related with medial is to the midline of the body, and anything lateral meaning to the side of the body. Superior means top, inferior means down, proximal. Proximal and means literally anything which is close by. Proximal meaning, for example, my shoulders are much more proximal to my face than my fingers. Now my fingers are much more distal to my face than my shoulder. Distal meaning far, cranial meaning anything to do with your head, caudal meaning anything to do with your tail, vastral meaning anything to do with the face forward, up in the skull. Superficial basically means anything which is towards the body surface. Deep meaning anything which is in the internal cavity, or anything which cannot be seen unless you remove the superficial layer or the skin. Then comes the anatomical terms of the movements. So flexion and extension, these two words, students always get confused between these. So when I say flexion, I mean flex your muscles, common term that you may hear. So flexion. So when your doctor asks you to flex your hand, you move it a bit in front towards the person, like as if you're shaking the hand. That in anatomy means flexion. And then when I ask you to flex your legs, you move them back. Just your knee a bit back, like as if you're going to almost kick something, but then you go back and then you're coming almost forward, but then you don't come forward. You just remain back. This is the position of flexion. And anything related with flexion and extension, they're always opposite to each other. So extension means extension of your arms means you're extending your arm backwards. And when I say extend your leg forward, you're extending it quite literally. And if I say extend your neck, you move it backward. When I say flexion, you move it front. So this is what it means. This is the pronation and supination. So an easy way to remember this is soup. So when you have a bowl of soup in your hand will be your palm will be facing up. And then when I say pronation, which means the opposite of supination, you will throw the soup down. So it's like soup up and then throw the soup down, which means pronation. Adduction and abduction. Adduction is basically adding something to your body. So you would say adduction, so you would move towards your body. And abduction meaning something which is lost, like kidnap or something, right? So which means that it's taken away from your body, so you take the arm away. Elevation is basically elevating your arm, or elevating your, for example, over here, this lady over here, she's moving. Mandible means your jaw, so it's in a normal position. Depression of mandible, she's literally opening up her jaw wide, and it's like she's shocked. So this is depression of mandible. Inspiration and expiration, it's basically inspiration and expiration of the lungs due to the diaphragm. So when you're breathing and when you're breathing in, breathing out. So inspiration is basically when the diaphragm, it contracts and then pulls downwards, while the muscles between the ribs and ribs contract and pull it up. During expiration, the diaphragm relaxes and the thoracic cavity's volume decreases, and the pressure in it decreases, and then lungs contract, and that's why the air comes out. Now, dorsiflexion and plantar flexion, mostly related with your foot. Dorsiflexion is moving up, plantar flexion is moving down. This is the biceps brachii, and I'm going to show you flexion. So when you're flexing, you're moving your arms towards and upwards. Now I'm going to show vastus medialis and how does it extend. So it's moving it backward. And then now I'm going to show pronation. This is how it pronates. It basically throws the soup down. Now I'm gonna show the supination. So this is the supination. Takes the soup up. This is the scapula elevating. This is the trapezius, and this is the elevation that I showed you guys. Now I'm going to show depression. It moves down. And then it also adducts. So what was adduction? Moving or adding to the body. So it takes, for example, when you're holding something and you're moving it towards your body. And then comes adduction, which is the tensor fascia latae. So I could show you hip abduction, which is moving away from the body, taking something from the body and moving it away. Dorsiflexion, which is it moves above, causes the foot to move up. We use this a lot when we're walking. Now I'm going to show you plantar flexion, which is caused by the muscle gastrocnemius. This is how it does. Goes and moves down to the floor. Thank you. I hope you had a really good time understanding. Please like, share, and subscribe. Comment down below what kind of topics would you like for us to teach. See you in the next class.